Good evening, Dr. Jeffrey.
Hi, good evening.
My name is Faizah.
Hey.
And I'm Kaif.
Okay, so Faizah and Kaif. Hi.
Yes. So, doctor, how are you today?
I am good. Fine.
So, do you know what are we going to do today?
Yeah. We're going to talk about COVID and depression, is it?
Yes.
For some mental illness.
Yeah, before that,
issues,
we are going to play a game.
Yeah.
Okay.
It calls First Thoughts.
First thoughts. Okay.
So, I'm going to say a word. And you have to you have to say the first thought that comes to your mind, which is related to the word.
Okay.
Yeah.
Okay. So
Cool.
the only rule is.
But you
The
must
first
tell
thing
it
that
faster.
comes to
Yeah.
my mind.
Yeah. The only rule is you can't say the same answer twice. You can't answer the same thing twice.
Yeah.
Okay. What if I say it twice? I mean, it's just wrong. Okay.
Yeah, it will.
I'll try.
Help.
Hospital.
Kid.
Kids.
Yes.
Annoying.
What?
Okay.
And why?
That means your kids are annoying.
Don't
Okay.
judge me.
Okay. Next question.
Therapy.
Therapy room.
Okay. Politics.
Boring.
Adults.
Slow.
Okay. Mentality.
Mentality.
Yes.
Rare.
Okay. Fire.
Burn.
Colleagues.
Cool.
Okay.
Okay. Exams.
Difficult.
Cat.
Phobia.
Agitated.
Waste of time. Agitated. I don't know. Pass.
Okay. Eat.
Eat is hot.
Okay.
Okay. Love.
Nice.
Dr. Jeffrey.
Boring.
I would say like cool or amazing.
Wow. I use boring already. Interesting.
Yeah, interesting.
Okay.
Phone. Phone.
Phone.
Yes.
Time.
Okay, that's all.
Okay, that's all.
Taking a lot of the time. Yep.
Yeah. So moving on to the next segment.
Yep.
Which is interview. Are you ready for the first question?
Yeah, go. Shoot.
Is quarantining doing a huge disservice to students?
Oh yeah. The answer is yes and no. Okay. Yes, because we cannot or we're unable to attend real on-site classes when teaching and learning has got a lot to do with connectivity, with connection of teachers and students. So this is a huge loss on our side, on the student side. But looking at what we are having now, what we are facing now, this pandemic, it has to be done. And there's no choice. There's no choice unless we have this in place. Yeah. We have always talked about the digital age. That means we are going towards digital, the digital era and all. So all this while, the digitalization is going slowly. But because of this pandemic, it had catapult the whole digitalization when it should take probably 20 years, but it took us only like 2 months.
Okay, for the second question. Is the government's decision to extend the MCO a wise one?
I think it's a wise one. Looking at the number of cases that we're having lately, it is reaching more than 1,000 per day. This is something that should be should cause. Should be taken seriously, definitely. So, and we also have to have some amount of trust in the Ministry of Health, where um, we should, we should have the trust that they know what they're doing. There's so many of them up there with all kinds of specialization specialized in public health, epidemiology, statistics, and all. So yes, I think a short answer would be yes. It's wise to do what they're doing now.
Thank you. So for the next question, what is your take on the mental health of workers, especially those that have been laid off?
This is definitely a big problem. The statistics show, or at least the news tell us, that we have people, around 1 million people who had been laid off in Malaysia alone. We're not talking about globally. So yes, definitely depression rates would be higher. Anxiety rates are higher too. We all have to be vigilant, be more sensitive with our friends or family members, because being locked down, being just confined to your own homes are not easy. And this is so much more a concern when we're talking about the refugees. You see, now we're talking, probably in your mind, you're thinking of a Malay guy or Chinese guy or Indian guy, the citizens. But what about the refugees? These are the first to be laid off, actually, right? These are the first to be laid off among all the other workers.
Is it true that the lack of studying and additional stress makes students more relaxed? Or is it just a temporary happiness?
Yeah, I can see some. I have a few. I have more than one kid, right? Um, so I can see half of them. I would say, right? Half of them, half of the kids that I know are very happy that they don't have to go to school. But another half would say they're so stressful because they can't go to school and meet their friends
Yeah.
and be in the proper class and meet the teachers and all. Probably it's coming from the type of personality that we're talking about. Some people are the extrovert type. The extrovert type are the one who is outgoing, they need people around them, they are charged. Their energy comes from people,
Yeah.
from talking, right? From interacting. So these kind of people are so badly affected, actually. But on the other hand, we have very happy people who are the introverts.
Yeah.
So introverts are so happy being under their skin, being in their own room with their books, with a cup of coffee, being alone. So what is lockdown? They have always been locking down
Yeah.
themselves.
Will this situation impact the education system or any system in the future?
Yes. You see, anybody who graduated, you see, we are talking about not semester breaks, but semester loss. People are losing semesters. They're not even studying properly for the semesters.
Yeah.
So there's a joke on Facebook, if I'm not mistaken. Somebody asked the doctor, "Hi doctor, can I consult you on something? By the way, when did you graduated?" The doctor said 2020. Oh, it's okay, doctor. I'll get another one. I'll get another doctor, because it shows that the doctor did not. Graduating in this year means you didn't really study for the whole year. You understand?
Yes.
So that means this doctor is half baked. It's as if he has not been studying properly.
Um, okay, this is the big question. Actually, personally,
It's a big
I
question.
really want to know this so badly.
Okay. All
So,
right.
can quarantining actually makes us go crazy?
Short answer, yes.
Yes.
Just being locked in your houses can can cause some people to go crazy. You see, medically speaking, we don't say quarantining causes some person to become schizophrenia, but quarantining like this could be a stressor. You understand? A factor
Yes.
to bring out schizophrenia in a person who's already being predisposed. That means it's already being having the DNA, the genetic predisposition in towards getting schizophrenia.
I heard that depression during quarantine is a myth. What are your thoughts on that?
Depression during quarantine is a myth.
Yes.
The myth, yeah.
Okay, I don't think it's true. I think quarantine can definitely be a big stressor to cause people to get into depression. Definitely, definitely. So that question is very wrong. It's not a myth. From an eyeball observation, I can safely say that depressive symptoms should be higher than normal
Okay.
this year.
So, how do you know if a person is depressed?
Depression comes with symptoms. So the most common symptom that people who are verbal, who are in touch with their feeling, the person would say, "I feel sad." Even better, a person would say, "I'm depressed." Right? We all use depression all the time. I'm depressed. I'm depressed. I'm depressed. So you need to be sad and low mood. That means no mood to do anything much. You have stopped doing things that usually cause happiness, like hobbies, right? Things that you like to do. So you stop doing it. And then you have sleeping issues. You're not sleeping well anymore. Probably too much sleeping. There's hypersomnia and also insomnia. So there's too much sleeping also is that's one kind of depression. You also have lack of sleep. But symptoms of depression among the Asians usually are bodily symptoms. That means people were Asians, Asians, I'm talking about India, Pakistan, Bangladesh, Malaysia, Singapore, and all. Asians usually complain of headache, body ache, shoulder pain, back ache, leg pain, very general complaints, which is there for long. But all these things that I'm telling you about, all these symptoms, it should be around for more than 2 weeks. Because you and I also had the symptoms for at least 1 or 2 days, right? We just don't have the mood to talk to anyone one day, probably half a day, and we straight away announce I'm depressed. That's wrong.
Yeah.
That's the wrong way to use the word, right? You're just sad. You're just having a day without much motivation.
Will COVID-19 alter the way we think since we've gone through a pandemic?
The way we think, yes, at least, yeah, the way we think and the way we behave. You see, everybody has taken social distancing, and mask and sanitizing your hands as part of our lives already. You see, we don't feel complete going out of our house without our mask anymore. So this has totally changed the way we behave and think about things. So all this while, probably you just use any knobs, any doors, you touch any railings, any surfaces you've been touching so freely. But now you think twice before touching anything, including touching your own friend's hand, right? Shaking hands.
Yeah.
So now we do a lot of fist bumps, right?
Yes.
Or maybe I don't know what you call, or elbow bumps, right?
So, if you were governing a nation and is faced with this crisis, what would be your course of action?
Well, that is not an easy question.
Yes.
If I am heading a government, I hope the country is small, not as big as India or China. First of all, I'll go on TV every day,
Okay.
show my face all over this. I'll give you guys awards, Dato Tan Sri and all, for being such great people. Yeah. Uh, Probably kill all the remaining politicians.
Oh.
Yeah, so that I remain in power for longer.
Wow.
Okay, that put aside. What would I do?
Like, what will be your course of action during this crisis?
Seeing now, it will not be much different.
What is the difference of the rate of depression between men and women? Which gender has the higher rate?
Oh, men and women. Women have more depression than men by almost 1.7 times,
Oh.
almost twice, almost twice.
So that's all for the questions.
Okay, I'm glad.
Yeah. I
Yeah.
personally actually learned a lot today from this interview.
Yeah.
Yeah.
Okay, but before that, we still have one more game.
Yeah.
One more game. Okay,
Yes.
game.
For wrapping it up,
It calls rapid fire.
Rapid fire. Okay.
so I'm going to give you two choices of answer that you must choose.
Okay.
Okay?
Okay.
Okay. Let's
Might
start.
just choose once, okay?
Just
Yeah.
choose. Okay.
Okay. School or work?
All right. Work.
Money or fame?
Money.
Work smart or work hard?
Work smart.
Smart. Okay.
Medicines or herbs?
Medicine.
Books or movies?
Books.
Oh, so you're a bookworm?
Yep.
Okay.
Think so.
Family or friends?
Oh, that's difficult. Family or friends, huh? I have my friends around here with me. Can I just say friends?
You're happy.
You have to answer honestly.
Yeah, honest
Yeah, friends.
friend. Okay.
Skip.
Uh, Facts or faith?
Faith.
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 Kill or die?
Kill or die? Kill.
Wow.
Okay.
Dance or sing?
One more time.
Dance or sing?
Dance or sing? Wow. Sing.
Okay.
Cats or dogs?
Dogs.
Wow.
Okay.
I don't like cats.
Okay. Give or take?
Give or take? Give.
Okay.
Burgers or pizza?
Burgers.
Sweatpants or jeans?
Jeans.
Yeah.
Dark or fair?
Dark.
Looks or intelligence?
Intelligence.
Okay. For the last question, childhood or adulthood?
Adulthood.
Okay.
Okay. Thank you. That's all for the question.
Okay.
answering.
You're welcome.
Thank you for being a sport today. Thank you for your time,
Okay.
doctor. Thank you for
Yeah, you're welcome.
yeah. I've really learned a lot from today.
Yeah.
I'm glad.
We learned like a lot
Yes.
from
And
you.
yes.
And we got to know more about you.
Yes.
Okay, thank you.
And I hope I can see you in other programs or maybe as our future guest.
Yeah.
Thank you. I hope to be invited again.
Mhm.
I'll be very glad to be with you again.
Bye.
Bye.